My name's Dr. Mark Bieszka. I'm a general surgeon here at Muskegon Surgical Associates. So today I wanted to talk to you a little bit about colon surgery. There's a lot of different reasons why we do colon surgery. A few that I want to hit on today are colon cancer, as well as diverticulosis. Let's start with diverticulosis. The colon is a stool storage device. It also helps to resorb a lot of water that's in our stool. Because of our good old American diets, we create a lot of pressure within our colon. And what happens is you'll get these little outpouchings on your colon that are called diverticuli. I describe it to people, if you think about like a car tire and sometimes you'll see the sidewall blown out a little bit, it's kind of the same sense. There is a little weakness in your colon, and because of the extra pressure, it created a little bulge. The problem with those bulges is they can sometimes get blocked off and become infected. Many people can get by with just some antibiotics to cure this. However, the antibiotics just get rid of the infection, they don't get rid of the diverticuli. Some of the symptoms that you may have with diverticulitis include lower abdominal pain. You may feel really nauseated and just sick. Some people will have some bad diarrhea or even pass some mucus or blood below. Some people will have fevers and chills. If you're having any of these type of symptoms, you should call my office or your primary care doctor right away, as these may be signs that you have diverticulitis. A lot of times we can treat diverticulitis with just antibiotics, and that is able to resolve the infection. Sometimes we have to go in and do emergency surgery. Unfortunately, if we do have to do emergency surgery, you may end up with a colostomy. A colostomy is a pouch that you wear on your abdominal wall that collects your stool. Typically, we're able to reverse this once you've healed up from your acute infection. Ideally, we try to get you through your bouts of diverticulitis with just antibiotics alone. If we're able to do that, then we can come back on an elective basis and remove that segment of colon that is diseased with the diverticuli, and we're able to avoid the colostomy bag. If you've had multiple bouts of diverticulitis, please call my office. I would love to sit down and talk with you and talk about possible treatment plans in order to prevent you from having any more of these acute infections. Sometimes surgery is the answer, and I'm able to remove that diseased segment of colon so you never have to deal with it again. Sometimes surgery isn't, but that's a specific treatment plan for a specific person. So please call me, and I'm happy to see you, and we'll come up with the perfect treatment plan for you. One of the other typical reasons that we do colon surgery is for colon cancer. Some of the concerning signs or symptoms that you may be having would be rectal bleeding, weight loss, family history of colon cancer, or if you had your colonoscopy done and precancerous or possibly even cancer was found. These are some of the reasons that we do colon surgery. Colon cancer is a very unfortunate diagnosis. However, if found early, we can cure you of your cancer with surgery. Colon surgery is something that we do very commonly as general surgeons. If you've been found to have colon cancer, typical treatment plans include resection of that cancer, and that's where I come in. I want to talk to you a little bit about what the whole surgery process entails. Historically, colon cancer surgery has meant very extended stays at the hospital. In the modern day of medicine, one of the things I employ is the Enhanced Recovery After Surgery program. And what this means is even on the day of surgery, you'll already be eating and drinking. On average, people are actually out of the hospital after about 3 days after having a major colon resection for colon cancer. Historically, people have been in the hospital for a week or two without eating and without moving around, but with our enhanced recovery programs, people are up and moving the same day of surgery. You're eating a diet, and like I said, average length of stay is about 3 days in the hospital. Colon cancer is a very scary thing, but it's very treatable. And I would be with you every step of the way, from your diagnosis to designing a specific treatment plan for you, to your surgery itself, to your post-operative care, to your screening for the next years ahead. I'm with you every step of the way. If you have any questions, any concerns, any doubts, call me. I'm there for you, and we're with you every step of the way.